Now we're talking about the shelter environment. Everything's the same, right? The only difference is before I described it as physical changes. Well, now we have to be looking at physical health, right? How are we going to deal with that? Behavioral changes. Now we're looking at health. So that's, we know when we get seniors that are surrendered to us, or they're strays or things like that, then there's going to be specific things we have to consider. But remember, old age is not a disease. Right. Oh, I wanted to bring this up. A real good source of information is there's a survey of finalists for the Maddie's Fund and Pet Finder marketing competition on senior pets. And as a matter of fact, it was in the Maddie's Fund newspaper. Oh, okay. Because I saw just the article itself. I didn't know it was actually in the newsletter yet. So that just came out in September. And it was very well written, I thought, for one thing, and did a great job of summarizing the results of the survey. But that'd be a good source to go back to. So the first thing is physical health. What do we have to do? We have to do physical exams, right? There should be a consistent theme here, guys, is the need for physical exams. That's how because we have patients, they can't tell us what's wrong. So that's why our physical exams are so, so important. Having caregivers, volunteers, and staff reporting problems. That's another thing, too. Like, we can't tell by doing a physical exam if a cat has diarrhea, right? We would need to have, unless, of course, they have staining in their anus area or something like that, but we would need to have our staff or volunteers let us know about it. So reporting is important. Doing laboratory work. Now, treat medical conditions as needed. As Dr. Manfred pointed out earlier this morning, and I thought this was great, dental problems. That's the most common problem that we see. And I love that shelters and rescue organizations are thinking about addressing this now, because we could really put ourselves in a better position to adopt these animals out. And they're usually senior animals, not always, but senior animals that have the dental issues. We'd be in a much better position for that. And then we have to, adjust any kind of exercise according to medical conditions. So if you've got an arthritic animal, it doesn't mean they can't go for walks, but maybe they're going for more limited walks. So, and that's where your medical team should be in a position to make recommendations on what type of activities and exercise that they should be involved with. Monitor, for emotional well-being. Well, just like with all animals, of course, foster care is probably the best, right? If at all possible. That's true for the older cats too. But what many shelters will find is that the older ones will find a home in somebody's office. That's at the shelter. This is, again, my cat Butch, who he loved to hang out with me in my office. And this is usually where he put his head, of course, when I was trying to get some work done, of course. But in a shelter environment, when you can't do foster, probably the two most important things to remember is to provide them with a quiet area, in most cases, where there aren't a lot of activities going on. And then if there's a play area, something like that, to separate the dogs. And it's true cats, too, if they have a play area, from the younger ones, where there's a lot more activity. So I kind of remember those two things. And providing individualized attention. As our nutritional needs change as we grow older, oftentimes you'll find more canned food and prescription food if needed. And then as far as exercise and play, well, with cats or with dogs, what we do is usually gentle walking. And maybe not for as long. Maybe you spend more time sitting on the park bench and giving them attention as opposed to actually walking. It depends on the individual. So that's the key here. And like I talked about before, in the play area, keep senior pets separated from the real young ones. Because the other part, too, is maybe another dog, a puppy comes up and they just want to play, but maybe they jump on an older dog and they're real arthritic. They could actually injure them. With cats, what we're talking about more is socialization and playtimes. Again, this is my son. We were at the Dane County Friends of Ferals in the well room doing some socialization of cats that we were trying to find indoor homes for. But the important thing there is to have socialization and playtimes with cats. And then as far as the environment is concerned, like I talked about, quiet area, foster care if possible, housing in a quiet area, providing softer bedding, I think is an important thing to do for dogs and cats. And make sure those litter boxes are easy to get in and out. That's definitely something to consider an older animal, because it's harder for them to do that. And maintain a regular schedule as much as possible.